big part of it is cultural. That we still have a ways to go in Montana in terms of recognizing the individuality of people with disabilities and changing the culture from one in which we make decisions for people to a culture in which we support people in their own decision making.
All right, we're back with Tall Goldin again, and I haven't previously introduced you. You are our advocacy director here. Why don't you tell me a little bit about your history with Disability Rights Montana?
Yeah, so I'm an attorney and I'm currently the director of advocacy here, so I oversee all the advocacy with the organization. I've been with Disability Rights Montana for about 10 years. I started here really focusing on K-12 education issues for about 4 years, and then I went to work for Legal Services as their director of advocacy for a couple of years, and then came back. And since I come back, I've done all kinds of different work in employment and independent living and public benefits and a whole host of different types of advocacy.
Yeah, protection advocacies get to do a lot of different types of work. And we talked about education in another podcast episode we did. Today, though, we're going to talk about something that kind of only protection and advocacy systems do. I suppose Department of Justice, U.S. Department of Justice could do it, but they don't. And that is go into settings that serve people with intellectual and developmental disabilities and monitor the conditions. Why is it that protection and advocacy systems are the only ones in our culture that get around to doing that?
Yeah, it's such an important tool that Congress gave us, the right to go in anywhere where a person with a disability receives services or lives, and to look around, to make sure they're being treated well, to make sure their rights are being protected, to talk to them, to talk to staff, and potentially to see their records. And the reason Congress gave us that authority is because the P&A system, the protection and advocacy system, was created in response to the widespread abuse and neglect of people with intellectual and developmental disabilities in large state-run institutions that had similar features. And the important features there were that they were locked-down facilities and they were geographically isolated, which means that no one was looking in and had the ability to come in, and bad things were happening inside under locked conditions. And so when Congress was reacting and trying to create law and responding and trying to create law for how we're going to address that, make sure that doesn't happen again, Congress had the wherewithal to realize a key is you have to get in the door. You have to be able to see what's going on. And so when Congress created the system, gave us that authority to say you can go in unannounced. We don't usually do that. We try to be collaborative in doing that monitoring work. But it was important for us to be able to go in under emergency circumstances and demand records quickly, get copies of any video that might apply in a situation, and talk to people. See. The other thing I think to note that's important is there's sort of two functions that Congress gave us in that realm. One is called monitoring, and the other called investigation, and they're not the same thing. So monitoring is we're not necessarily looking in response to a particular problem we've been notified of or identified ourselves. We're just checking in. We're just going there to see how people are doing, maybe to give them some information about their rights and do some education, both for staff and for personnel, or for consumers, and see how things are going. Investigation is different. Investigation is we have a report, or we ourselves identify something that potentially could be abuse or neglect, and we're investigating a specific instance or series of instances that could rise to the level of abuse or neglect.
Yeah, I think as you were explaining that, and I was thinking back, the protection advocacy systems were created about 50 years ago. The Rehabilitation Act and Section 504 was about 50 years ago. The Individuals with Disabilities Education Act, or what it used to be called, was passed about 50 years ago. We had a cultural awakening that people with disabilities, specifically at that particular time, a lot of people with intellectual and developmental disabilities were being mistreated. They were either not being allowed into schools to get education, so they needed the Individuals with Disabilities Education Act. You had people with physical, sensory, intellectual, developmental disabilities not being hired by the federal government or not being allowed into access programs that anyone else in the United States gets access to. And then you had, if you couldn't stay home or you were told by the experts, just get rid of your kid, send them to the experts. We know what we're doing. You send your kid off to an institution, and in those institutions, people with disabilities are being mistreated. So all of this was coming to a head, and Congress was creating different responses. And one of them was to create us, a protection and advocacy system in every state and territory. And we do monitoring. And from day one, we were focused on people with developmental disabilities. And back then, almost all people with developmental disabilities, if they weren't living at home with their parents, they were living in a large state institution. And that is not the case now, especially here in Montana. Disability Rights Montana has done incredible work in the past to move service delivery from an institutional model down in Boulder, and everybody just being sent from all over the state to one institution in Boulder. And now we've got services across the entire state. But that also means you can't just in one day swing by and see how everyone's doing. Everyone is spread out all over the whole state.
Yeah, that is true. There's a lot of facilities to monitor. Some of them are operated by the state. Lots of them are also operated by nonprofits or private entities like group homes. And so there's a lot out there to monitor for sure. And there is more of a distribution now, which means we have to be more vigilant in going out to a variety of different places and checking on our people.
And the old idea of out of sight, out of mind, set up a large facility in a rural area, that was done all over the country. That was done in Virginia and California and Washington and Montana. Now the idea of getting people in the community, the idea is then there are more eyes on, more people to keep people safe, more opportunities to live a spontaneous, individualized life, however you want to put your life together as a person with a disability. But one of the problems could be if you are just moved from one big institution to a small facility, but you're not integrated in the community, you can still be out of sight, out of mind. You're just in a subdivision where there are 100 other houses that look exactly the same, and no one would know behind the doors of this house there are 6 people with developmental disabilities living and not ever leaving the house. So what kinds of things did you see when you went out? I imagine there's, it's quite different in Scobie than it is in downtown Missoula.
Yeah, I think that's a really important point, and maybe unique to Montana because of how geographically spread apart people are. There is some protective feature of people living in community settings and going to the market and going to school or college or going to their doctor's office and talking to other people, and other people have eyes on. But that also is very different if you're in a group home in Scobie. I don't know if there is a group home in Scobie, but
I know we went to Plentywood. Scobie jumped out because we've got an advisory council member in Scobie, but I'm sure they have a place in Scobie.
And so there's a smaller population. There's less interaction with the community. It doesn't have that same protective feature as say, if you're in Missoula and these are your neighbors, and you're looking in on your neighbors. So there's that piece. And I think the other thing that's important to note is there's a large variety of group homes that we visited, run by many different providers in many different communities. And so it's certainly not a one-size-fits-all approach, nor is our perspective or concern one-size-fits-all. There were a lot of places where we observed some really good things. And when I say good things, I mean we were looking at how much individual choice over a person's day-to-day life do they have? Are they making choices about who they live with? Are they making choices about what they eat? Are they making choices about what they want to do with their day? Are they making choices about their work? So one part is the piece of individual decision making, and which is very closely related to the idea of human dignity. That dignity comes from the ability to have choices over the things that impact us the most, including what happens to our bodies and who we live with and what we eat and what we do all day. And then the other part I think that we're looking at is how well are people's rights preserved in that process, in that living environment, or in that day programming environment, and how much choice do they have? So I think in thinking about sort of those two big areas, and they're really big, right? When we think about just a person who doesn't live in a group home, the choices that we make every day, those are some of the most important choices that make our lives meaningful, right? And I think it starts with this basic idea of like most of us choose who we want to live with.
Right. It's pretty rare that you don't choose who you live with. You might choose a roommate. You might choose a partner. You might choose to have children, choose not to have children, choose not to have a partner, choose not to have a roommate. And money impacts whether or not you choose to have a roommate or don't have a roommate. Money may impact whether or not you choose to have children, don't have children, do I have 5, do I have 2? But so I'm not saying everyone gets all choices, but we certainly do, among the options available to us, get to make lots of choices. What were some of the things you saw around that when staff were going out to those places?
Yeah, so some of the things that we saw, particularly what interesting, were around food and choosing what to eat, and we saw a lot of variance here. We saw some places where there was a great deal of control over access to food, which is very concerning. Whether a person, and remember, we're talking, these were all adult facilities, right? These were not group homes for children. These were all adults. Some of these folks were under guardianship, not everybody. So meaning that some people legally were entitled to make their own choices. And we saw some places where food was under lock and key. We saw other places where people got to choose their own food, and they got to go to the market and buy the things that they liked. They had their own place to store it. They had their own compartments in the Frigidaire, and they had some choice over what it was they wanted to put in their body. Another place, where we see this very frequently is, what do meals look like? And so in some places that are sort of the most concerning, you see everybody eating the same meal at the same time. And in the report, there's this example of like everybody had a hot dog, like a single hot dog on a piece of sliced bread, like no bun, no condiments. And that's concerning because that's clearly like not an individual choice, right? It's very unlikely that all of those people chose to eat the exact same thing, and that nobody likes hot dog buns.
Yeah.
Right? And they're all eating at the same time, and they're all eating at one long table with all these other people who they didn't choose to live with. And again, like,
I don't think I could even pull that off in my own house with me, my wife, my son, and my wife's parents. We all live together, and I don't think I could convince all of them to, one, eat that particular meal, but to all eat the same thing all the time at the same time. It's quite frequent we have 4 different meals going on because of either dietary needs or preferences, or someone's got to get to this event here and there. So, yesterday earlier this week I was in Billings, so I was late. I didn't get home. I can eat what I want when I get home, and I didn't want to eat what they were going to have anyway. So that worked out great for me. But that's life, right?
Yeah, that's true in my house too. It's rare that I'm serving the same meal to my 2 kids and my wife at the same time.
Yeah.
Like they're all have their own preferences. But again, like thinking about now, in my family, we have a similar culture. We have similar religious backgrounds, but not the same. But now you take a group of people, 6 or 8 people who live in a group home who aren't from the same family, who maybe have different religions, who have different cultural backgrounds. There's a pretty good chance that they don't want to eat the same thing, or for religious purposes can't eat the same thing. And we want to make sure that people can access those individual choices. I also think about like how important is what we eat and with whom we eat and when we eat to our personal cultural preferences, right? And our own identity.
Mm-hmm.
We're a healthy eater, we're a vegetarian, whatever it might be, or we keep kosher or halal,
Mm-hmm.
whatever it might be. That is different than somebody who just randomly ends up living in a house with me.
Yeah. And man, you really can't get to anything that's more wrapped up in emotions, celebrations, rituals than food. I mean, it is important in every culture. We literally have restaurants that the genre of food is named after the culture it comes from. We know that it is so tied to identity. It is so tied to your upbringing and to who you are. And, this is my comfort food because my mom made it or my grandma made it. And this is, my hobby is cooking this way or doing that. And like people build a lot around that. And then to take that opportunity away from people to be fully human, and instead be a part of some larger industrial process. That's what I was trying to get at earlier when I was talking about, like, it's one thing to say people shouldn't live in large institutions in one spot or 2 spots in a huge state. And but you can also institutionalize people in small settings. And I often will draw a picture when I'm trying to explain this to folks, or I'm in a room with people and I'm trying to show this distinction that I have this large rectangle with a smokestack on it, and that's a factory, or a psychiatric hospital, or an institution, an intermediate care facility for individuals with intellectual and developmental disabilities, and ICF-IDD. We have lots of acronyms in this world. Or you have a house, and everyone knows what a house is, and it's just a little, thing with a roof on it. But it could also be a tent. It could also be an apartment building. But it's not a factory. What's the difference here? We've got world famous anti-Semite and capitalist saying, let's strip all of this human work down to incremental parts and create a factory line, the Ford model. And we use that during industrialization to make a lot of money off of labor. But we also used it to make a lot of money off the labor of delivering services to people with disabilities. The rise of institutions, and you strip down the humanity of this and say, okay, I am going to pass meds from this time to this time, and I will do this with this person. I will pass food from this time to this time. I used to be a cook in a nursing home. I know how this literally works. How do you feed 200 people? It's not that hard if your focus is on delivering the food. If your focus is on the people, it starts to become a lot harder. Because, like I said, I have a hard time figuring out how 5 people are going to eat in any given day when you're doing it individually in a house. But if you're going to do 200 people in one nursing home, or 25 people in a group home, or 8 people in a group home, if you still have the institutional model of we eat at this time, we eat this way, we do things this way, this is when you take a bath, this is what we watch on TV when we watch on TV, that's not how human beings work. That's how industries work.
Yeah, and to me, it quickly degrades the quality of life, to put it bluntly. I was thinking about, I had some major surgery earlier this year and spent some time in the hospital. Spent a lot of time in the hospital, but how quickly having all those choices made for me impacted me personally. And I was only in there for a couple weeks versus years.
Yeah.
But even as much as, like you were saying, I had to take some medicine and go to sleep. Well, I didn't want that medicine at 8:30 when the nurse came around at the top of her shift to pass it around. I wanted it when I wanted to go to sleep at 10:30 or 11:30, right? I was able to negotiate that with the nurse. Lots of people living in group homes aren't able to negotiate that. That's when medicine is passed. That's what they're going to get it. And the removal of those choices, very quickly, I think impacted my own mental health, I would say. Very quickly, it became very hard to deal with. So I think about, people who are living in group homes, and all of those day-to-day choices are made in a certain institutional model and uniformity. I imagine that's very hard to live with.
Yeah, I also used to deliver services in the homes of people with developmental disabilities, and know that when you have a regimented day, it can be relatively easy as the staff person, but it can also drag on. I think if we focused more on the humanity, the messiness, the chaos of, I want to go here, then I want to go there, and I don't have enough money to do that, I guess I'm going to go home for a little bit. Like if you just let life happen a little bit more, it wouldn't be quite as predictable, but getting through the day would be a lot nicer, a lot better, not just for the people who live there, but the people that supposedly the industrial model is designed around, the staff. But I would posit it's still not designed around the staff, just as the factory line is not designed around the factory workers. It's designed around the product. So Medicaid says we'll pay for this, we'll do this way, we'll design homes that break even at 8 people a home versus 4 people a home. And so even the staff who are there are a function of the reimbursement rates that we provide, the relationship between the state and the federal government and how they put together their Medicaid programs. So then we get to the point of, well, how would you go about fixing this? Well, we can fix this because this is all man-made. None of this is the way things have to be. None of this is a product of the disability. None of this is a product of science or medicine. It is purely a product of policy and budgets of the federal and state governments, really.
Yeah, I think that's right. I think it's a creation of what we write down in law and regulation.
Yeah, and you're only going to get what you design your system for. There's a great advocate that I used to get to work with, Curtis Robinson, and he would, whenever anyone would say the system's broken, he's like, no, it's doing exactly what it was designed to do. It just wasn't designed for you. And so this system's doing exactly what it's designed to do. If we want it to do something different, we just need to design it differently, and it will start doing that. Now, some may say, all you saw were anecdotes, and that's true. We're not scientists, we're lawyers and advocates and stuff. But how many places did we go to?
We talked to almost 700 people, and we went to around 100 either group homes or day programs.
So in Montana, that's a lot of people. I mean, in any state, that's a lot of people. But to get to 100 settings in Montana, we were, like we were talking about before, went to Plentywood, went to Libby and Dillon. I'm trying to think of different corners. I don't know how far southeast we went because there isn't a whole lot southeast, but we went as far as we could to learn as much as we could. And what we saw wasn't isolated, but it wasn't also a rural-urban divide, right? It was really house by house or provider by provider. How are the human dynamics going on there?
Yeah, it was not our intention to do a scientific study, but I think it was a pretty broad and representative sample in terms of at least a qualitative look at what's going on and how people are doing. And you're right, it cut across all kinds of different settings and all kinds of different communities. I left sort of thinking about this with the feeling that a big part of it is cultural, that we still have a ways to go in Montana in terms of recognizing the individuality of people with disabilities and changing the culture from one in which we make decisions for people to a culture in which we support people in their own decision making. And we give people with disabilities, just like everybody else, the dignity of risk, the right to try things even when they might result in bad things happening to us. We might lose money, we might get hurt, we might get our heart broken, but we try things and we learn from things, and that's how human beings learn, and that's what builds richness in life. And I think we have a ways to go in Montana to really embrace that idea that everybody has that right to dignity of risk and to make their own choices. And how do we really build that up in the way that we deliver services and the way that we think about how we help people with disabilities?
Which is, in one sense, ironic, but in another, maybe promising, because I don't think we're that far from being able to make that connection. We're the land of rodeos and four-wheelers and skiing and rafting. None of that stuff is safe. That's all risky, but we do it because it's fun. We do it because that's what life is about, is doing what you want to do, not what you're supposed to do. That gets back to some of the food stuff, too. I mean, good Lord, if I did everything my doctor told me to do when it comes to my diet, I would not be who I am today. Would I be healthier? Yes. Would I live longer? Absolutely, I would. Do I need to do better? Yes, but I need to do better. I don't need you slapping a sandwich out of my hand. And that's, I think, something every Montanan can get, that the dignity of risk is from everything from the mundane of what do you eat? Do you get to eat frozen burritos and pizza on Thursdays instead of Fridays if you're, quote, good? Or do you get to, go skiing and break your leg or tear your ACL? I'm like, well, yeah. The safest thing to do would be to sit inside and wither away. But you wouldn't have great mental health, and you may not really like that. That was one of the images that came to me in reading the report and hearing stories from staff of people spending their days in warehouses, literal warehouses, when we live in Montana. It's not because we have the nicest, fanciest buildings to sit inside all day, but because we have world-class outside. So that alone could be a relatively simple metric of how much time does someone get to spend outside? And did they choose what they got to do? And so I'm appreciative of the work that folks did, putting in thousands of hours and miles to do this. Folks can read the report. We'll put a link under this to get access to that report. And no, I've already had officials from the state reach out and say, we want to work on this. So let's sit down and talk together. So if you have ideas about what could be improved and you want to be a part of conversations on how to make this improvement, reach out directly. I'll put my email address right under this video. You can reach out and we will build the cultural shift that we need to see here to get a Montana that appreciates the dignity of risk at the bucking horse sale, also appreciating the dignity of risk every other day in Miles City in the group homes that are delivering services.
Yeah, I think that's right.
Thanks.
Thanks, David.